Welcome to the next segment of our learning series on team-based care basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. In this segment, we will use materials created from previous segments to finalize the plan and implement team-based care. In the last segment, we established our team composition, helped prepare our team for our changes, and took what we learned from this process and updated our design for team-based care. In this segment, we will ensure that clinical and administrative supports are in place, review communication structures to support team-based care, finalize our planning, and begin the implementation. We have designed our model and decided on our team composition. Now is the time to decide what changes we will make to establish team-based care. We will want to make a list of the changes, including the new services we want to include in our initial model of team-based care. These are just some examples of changes or services we might include. Let's take a look at the Primary Care Team Guide website again. Under the Do the Work section, we can review recommendations on how to deliver new services and functions within our team. Again, each learning module provides an overview, action steps, and the tools and resources we might use to implement our team-based care model. Another resource we might access is the Cambridge Health Alliance Model of Team-Based Care Implementation Guide and Toolkit. This resource may provide information on the elements and actions needed to implement our team-based care model. A link to this resource is available in the description below. Also keep in mind these key elements of team-based care and make sure to incorporate them as part of our model, as well as the core concepts of team-based care. Detailed information on the key elements and core concepts along with other guiding principles can be found in the segment titled Terms and Core Concepts. Let's take one last look at what we will include and finalize our design. Initially, we may have identified multiple new services and changes. At this point, we will prioritize what to include. If needed, we can break our implementation into smaller pieces, phasing into our larger vision of team-based care over time. Many factors will determine where we start. It is now time to decide what we will include. Using the list of changes and services we will include in our team-based care model, we will revisit the planning we performed as we define the roles for our team and make sure each of these components have been addressed. Performing this planning for each change will ensure everything is accounted for in our implementation plan. Communication is the backbone to delivering successful team-based care. Communication is needed between team members, with our patients, and with our stakeholders. Now is the time to decide how and when we will use these communication strategies and structures, and include what is needed to implement them into our plan. Along with the staff assignments, other factors may come into play to make our team-based care model work. Some of these items may limit what we can do now or change how we design our team or services. Make sure to consider all these elements as we decide what to include. Health information technology can help support team-based care by improving communication, coordination, and efficiency. These tools can help increase access, equity, patient safety, and expand the independence of our care team. Data plays a crucial role in team-based care. It can help identify population health initiatives, gaps in care and equity, provide data for performance tracking, and data to support quality reporting requirements. Data sharing enhances care coordination, understanding of social drivers, and improved communication across the care continuum. We can review recommendations from the Health Information Technology Basics Learning Series for more recommendations on how we might use health information technology and data to support our team and the delivery of team-based care services. A link to this resource is available in the description below. Assessing what might affect our successful implementation and weighing any impacts allows us to better prepare. Risk assessment includes identifying risks, assessing their probability, meaning how likely they are to happen, the frequency or how often, and the impact they might have on the successful implementation of our team-based care model. Performing a formal risk assessment can help us plan for how we might manage, control, and respond to potential risks. For each of the performance measures we selected, we need to create a plan for how we will collect the data, who will collect it, and how often. We want to determine how we will track this data over time and establish a baseline data point for each performance measure before any changes have been implemented. This helps us establish our current performance. We will use this data to monitor and track our performance and ensure the changes we make have the effect we want. Now is the time to finalize the list of changes we will include and ensure we have thought through all that is needed to support each change. Again, some of this may have been done in the previous activities. Identify the tasks we need to perform to put it all in place. Then assign who will perform each task and when it needs to be done. This will become our implementation plan. No single core team structure works in every situation. We will want to use the PDSA cycle to rapidly test our design and identify any needed modifications. Pilot testing, meaning testing on a small scale first, helps us identify the impact of the changes and opportunities or issues to address. It provides actual data that we can use to help refine our process before rolling it out on a larger scale. It can help us better understand any additional training needs of the team and how the model is being adopted. And most importantly, it will help determine if the changes we implemented meet the goals we set for team-based care. Pilot testing and adapting the model based on our results increases the chance of a successful implementation across our practice. We can access the Quality Improvement Basics Learning module to learn more about using the PDSA cycle for testing and implementing our changes. We will choose our pilot testing criteria and begin testing our new team-based care model. We need to be sure to communicate the expectations to all of our stakeholders. As we move through our implementation, we can identify opportunities to expand the skill set of our team. Cross-training involves training a person on tasks that are not part of their current responsibilities. We want to encourage our team members to actively engage in cross-training and knowledge-sharing activities. This will help build the capacity and skill set of our team. There are many methods we can use for cross-training. Learning by doing can be done by shadowing someone else on the job. Coaching is where a subject matter expert or other skilled employee assigns work to an individual. The individual completes the work on their own and is evaluated or coached by the subject matter expert. Peer training is teaming individuals up with more skilled employees. As they work together, the novice individuals can learn and develop new skills. And self-learning, which includes reading material, certifications, and other forms of self-education. As we go through the implementation, it is important to create a psychologically safe environment. Some ways to do this include leading by example, creating an open and collaborative environment where it is safe to provide feedback and have honest communications, protecting team members when we make a mistake or take a risk. These are opportunities to learn, gain skills, and encourage critical thinking. We can also show our appreciation to our team members by providing reinforcing feedback, letting them know when they are doing well. Feedback is only useful if it is given to help advance an individual's progress or improve performance. Done well, it helps increase motivation and encourages collaborative problem solving. It involves deep listening and a high-quality connection between team members. Feedback should focus on strengths and areas for improvement and can help build a trusting foundation among the team. When giving feedback, it is critical that all feedback is delivered as soon as possible, whether it is positive or constructive. You want to reinforce good or positive behaviors and habits and to quickly address and correct any behaviors and habits that are unfavorable. As a rule of thumb, praise in public and critique in private. To set up for success, we want to ensure that individuals and the organization are prepared for the change. Make sure our communication is clear and focused and that we communicate often. Ensure our team is equipped to perform their new roles and assignments, and that we continue to involve key stakeholders as we implement our changes. The calls to action for this segment are: develop and implement our plan to establish team-based care services, create a psychologically safe environment to support our team, and establish the baseline data for our performance measures, using the PDSA cycle to test our changes and adjust our design as needed. In the next segment, we will review how to sustain team-based care workflows and services with revenue-generating and cost-saving strategies and continuous quality improvement. Thank you for joining us.